Brooke. I am a licensed therapist. I'm also a spiritual healer, teacher, and writer, and a mother. Well, I'd had CPTSD for many, many years, decades in fact, and I tried all of the typical treatments. I am intractable when it comes to the psychotropics. They don't work for me. They cause unpleasant side effects and flat affect, and I just don't tolerate them well. And so I decided when I had a recent flare-up that something had to shift. It was sensitive to time, and I needed something with high efficacy, wherein I researched Ketamine Clinics LA, and I was happy with what I saw and thought I'd give it a try. I was nervous when I first came in, yet I was greeted by a really welcoming staff, good vibes, high energy, really clean facility that helped ground me immediately. I was very blessed to have a wonderful nurse throughout the entirety of my first series. That helped immensely. And I just really liked how it almost had like a family vibe once I came in during those 6 days in succession. And for this type of treatment, that just added to the safety and the comfort, and in some ways the efficacy, because I was comfortable, I was able to go deeper, and then I took more from it. For me, I have experience with altered states. I work in transpersonal psychology, so it's something I'm comfortable with, yet as this is an allopathic medication, I didn't know what to expect in the beginning. I learned very quickly that I preferred ketamine to other available plant medicines because you're titrating the dose, you're checking in on us often. And for me, being that I spend a lot of time in meditation and doing such work, I could tolerate a higher dose and it was therapeutic for me. But knowing I was monitored and if I needed to pull back or go forward a bit, that added to that comfort so that as a meditator, I could really control the session and drop in deeper, knowing that someone consistently was watching, monitoring, and assessing my safety. During the first series where I did 6, I would say the shift was most notable after the 3rd session. I did feel the brightening, the happiness that happens after the first 2, yet it was short term. On the 3rd, I started noticing the hypervigilance from my PTSD was starting to calm down. The night terrors that I'd been going through for months disappeared and have yet to return. And that was huge for me. And that's when my comfort with the treatment modality really expanded. And I started bringing in some techniques I knew to enhance the medicine. And that was revolutionary for me in so many ways. And the greatest gain that I didn't expect was the chronic pain efficacy. I have dealt with chronic pain in conjunction to my mental health struggles, and historically have taken a cocktail of terrible medicines and came off of them, but didn't really find great relief. I was doing tons of holistic interventions, very expensive to maintain, yet the ketamine, surprisingly to me, completely took away the nerve pain after the 3rd, 4th, 5th session. So when I chose to come back for boosters, it was not a mental health choice. It was to suppress the nerve pain, which has been extraordinary. I feel like my kids got their moms back in a lot of ways. I did my first series of the 6 beginning in March. I did not have a booster until June, and that's the only one I've had. I did do the extended, and I really like those. They're definitely my preference. But for the mental health, I feel it's been very effective, particularly for depression. Some of the hypervigilance stuff I have seen resurface, yet it's at a much lower threshold, wherein the spiritual psychology, yoga, meditation, they're able to bring it down, and there's not such a need to have another booster per se at this time. So, I feel first and foremost, it was the friendliness. There was a great effort to treat you as a person more so than a patient, and that's really important with any type of mental health care. Also, I was pleasantly surprised when I did the research by what the facility looked like. I did admittedly have a stigma against ketamine because my only past exposure had been through the rave scene. So it wasn't a good scenario for me as far as treating it like a medicine initially. But when I came here and I saw the staff and met the nurses, and that was after speaking to them in depth on the phone, I felt a lot more safe. Other places I researched, that wasn't my experience. It was more like pay, go, that's that. And that to me felt a little bit more shady and not something I wanted to test the waters with. I had no negative side effects. The only, for me, because I do utilize a higher dose, it was really just about grounding. And I always had an excellent experience where my nurse made sure I had a little bit more time. And then I would find a park nearby and just go be in nature. But to be quite frank, I'm the single mother of 2 children, and I would do the first session of your day and I would be taking care of my kids 3 p.m. on. And I was absolutely fine. In fact, they probably thought I was nicer than normal. So one thing I did learn with ketamine that's similar to other plant medicines, but I think it's beneficial for persons to know, is that having a mantra that you take in the beginning, if you ever get into any of those places, it can really help call you back. And some of those places, I didn't have really dark journeys, but there would be moments where it would get really intense. But some of those spaces were when the medicine was most helpful. So it's really important to know your own threshold, but to also, if you haven't experienced before, be open to learning the medication and treating it as sacred, like you would any other plant medicine, perhaps. And that gave me the opportunity to interact with it in a different way and develop trust with both your staff, with the medicine, and then with myself as the recipient. I am aware that there are critics that believe that if ketamine infusion therapy is not done in conjunction with psychotherapy, as in a psychedelic assisted therapy model, that it does not behoove the client and/or is not safe. I myself am a licensed clinician. I understand that concern, yet I would also advocate that there is no one-size-fits-all model. Psychedelic assisted therapy for many persons is not affordable here and now because the medications themselves are quite expensive. So if the person has the inner resourcing and they've had consistent psychological interventions, I feel it's perfectly safe. If someone is not doing anything to integrate it and taking it by itself, I can see risk factors there. Yet as someone who's high functioning, has therapy themselves, and also guides other persons, I felt completely safe. And so there's also the part of it wherein persons can creatively process this. For me, that was probably more radically important than talking to a therapist afterwards, just really journaling the experience and being present with it, embodying it, and then integrating it. So I do feel that there's a time and a place for psychedelic assisted therapy, and for certain nomenclature, absolutely, without a doubt. But for someone that's high functioning, I do feel that this is perfectly safe. Well, I can say that I've had a history with polyaddiction in my youth, and I have no intentions of abusing ketamine ever, okay? It's not the kind of drug that you come out and crave. When I finished my 6 series of boosters, I was done. I had gotten what I needed to. I had what I needed to alchemize out of the medicine to really begin to embody it, and it was enough. I never woke up wanting more or to go into a journey to escape my life. There was nothing maladaptive about it. Instead, there was a reverence for the medication and a respect for it. However, anytime you have addiction, you have to assess that individual to individual. Probably the only thing is I wish I had done it sooner. Honestly, I spent so much time in the other worlds studying plant medicine and respecting them, but the allopathy had turned me off so deeply to ketamine because I'd had really severe responses that led me to a coma. with allopathic medicine. So I never guessed it would be an allopathic medicine that helped me heal from all of that. Quite frankly, I've dealt with intermittent suicidality for the bulk of 30 years in the wake of complex trauma. And so I'm very empathetic and aligned to the depths of hell and suffering that come with chronic depression and complex PTSD or just generic PTSD. And suicidality is so shamed and so stigmatized in our culture that few people actually talk about that, even with their therapist. And I've been on both sides of that. And so you don't have to rely on outdated paradigms, such as certain psychotropics or talk therapy, which actually often re-traumatize and heighten the symptoms. Ketamine offers a solution for suicidality. It's really what got me to choose to use it when I saw the efficacy rates. You don't see that immediately with talk therapy, and you don't see that with psychotropics. So if someone's really in the depths of their despair and they have nowhere else to go, this is a way to get quick relief that lasts. And that, there's no price tag you can put on that. Okay, so I understand the self-investment for the ketamine is quite expensive, particularly in this economy, and for folks that have been struggling with their mental health and might not be working. I myself, when I chose to take this particular treatment modality, had just won custody of my children after suing for domestic violence, the cost of which was extraordinary. And I did not want to invest this much money in a treatment. It would have been much easier to go to my insurance and take what was given to me. However, if I had gone down that path, I don't think I'd be sitting here talking to you. I don't think it would have worked, and I don't think my children would have their mother. So for me, pulling the cash out of other things that we did not need and choosing my well-being and being present and healthy for my children was worth every penny. So yes, it's a significant self-investment, but so is your well-being, so is being here, so is your radiance and gift and presence in this world. I'd say the absolute greatest takeaway as someone who's an overthinker and overly analytical and gets trapped in their monkey mind is that it allows us to bring down the threshold on all of that noise so that we're stepping more into the higher mind and connecting more with, to me, our higher consciousness, so that we're then able to anchor into whatever our system might be connected to, whether it's the sound in the room or the thoughts in the mind or the intention of the session or what you want to release. It varies person to person, but the ketamine allows you to let go of the I, the ego. And then you're able to drop in more to the heart. You're able to hold things like horrific traumas with neutrality, because it's not so much about you, the human vessel. You're more, in a lot of ways, dealing with yourself as a soul. And that allows you to experience yourself in a whole new way, or the story that the monkey mind's been telling can be reoriented. And so it's this beautiful dance in between realms. You feel your body, you're still connected to the body, yet you're not completely stuck in its stories, nor are you stuck in the mind. It really allows you to drop more into the third eye and the higher knowing and the wisdom that's beyond all the things we tell ourselves and other people have told us. So there's a sort of floatiness, but it's also grounded with the body being present. Well, I would say a big surprise for me was how much I liked coming here, because I was coming in part to heal medical trauma. I had been comatose and had a really horrific experience when I came back into my body. And so it was beautiful to have your staff be so attentive in the way I hadn't received it with my coma. And so much for me of the sessions was releasing that memory of coming into the body and being locked in for days with no attention and no communication. So every time I had a session, the callback, I would really focus on choosing to come back into my body, choosing to be treated with love, choosing to receive it. And that had an immediate efficacy. Like that week, so much of that trauma went away. So that was brilliant. In addition, the nerve pain, huge. I would say being able to know now that the threshold of my symptoms as they present have a modality that can treat them if they heighten again. There's a peace of mind that comes with that. Whereas before, when you feel yourself beginning to spiral or become symptomatic, you often panic. And a lot of times there's denial and suppression and shame. Now I don't feel myself going to those places because I know I can just pick up the phone and I could do another series or whatever I need. There's a resource and an ally in the medicine and your staff at Ketamine Clinics LA that I appreciate. So.